The San Ysidro Clinic is an awesome opportunity for students to come down and give back to the community while getting some hands-on practical experience. We come down here, about 30 of us, teamed up with the nurse practitioners, and we usually see about 100 patients over the span of 2 days. Patients come all morning and come all afternoon, and younger classmen pair up with upperclassmen, and they work together with the attendings to treat this underserved area of people who don't always have the opportunity to receive medical attention, much less specialized foot and ankle care that is often needed.
I love coming to these things just because you are able to serve a community that would most likely would not be able to get this care. I mean, sometimes they can't afford it, or so for some other personal reasons they can't reach out to their doctors and such, and so they come see us and they feel very comfortable coming to us, and sometimes they leave, I mean, they always leave happier than they came, so that's why we do this.
What we made sure to do this year was to bring lots of Spanish speakers with us to really be able to communicate with the population. One of the biggest problems is, Latin communities are underserved medically because doctors can't communicate with their patients. So we really made an effort to recruit Spanish speakers so that everybody, like if you're treating your patient, you speak Spanish, or at least you're helping somebody else translate, and that's helped out a lot. We're also collaborating with FNPs who take blood pressure, blood glucose levels, and that really helps because by the time the patient comes to us, we already have a good idea as to where they are, like where their diabetes is, where their blood pressure is, and that helps us with our diagnoses and what we could do for the patient.
I've done blood pressure checks, blood sugar checks, I've translated and gotten to know a little bit about what resources are limited to people either on this side of the border or who come from Tijuana, and in comparison with what I'm familiar with in Alameda County, it's very different.
This isn't a clinic that is part of the curriculum at the school. This clinic also isn't a graded clinic, so the students feel a lot more comfortable in trying different tests and being vulnerable in their evaluation and in feedback from attendings. So this is a really great opportunity for them to learn in a much low stress environment because we're not grading them. So they feel a lot more comfortable with making mistakes, and that's an important part of clinical care, knowing when you're making an error and knowing subtle signs of performing an objective evaluation that may or may not be efficient.
Entonces, ¿quiere que la ayude a llenarla? Ok, en un momento la ayude.
There's one in there. Yeah, that would be bad.
¿Usa medicamentos?
Sí, tomo para el colesterol.
We've been checking people's blood sugars to see if they should be concerned about diabetes, checking their blood pressure to make sure that they're within the normal limits, or if they should be seen for hypertension. We've been evaluating medications for them to see if they need to speak with their providers and have any changes in their dosing or anything like that.
There's a lot of people here who don't have health insurance, they don't have citizenship, they don't have access to medical care that they need. Just coming here and getting their blood pressure checked, their blood glucose level checked, their feet monitored is really big for them, just to get a baseline of where they're at and get the help they need.
¿Y eso, el dolor lo sientes enfrente o a los lados?
No, enfrente.
Enfrente, aquí. ¿Como del hueso o de los músculos?
De la espinilla.
De la espinilla.
The 10-year-old boy coming in with his mother. The mother told us his history, that he complained of lateral foot pain for the last year. They've tried ibuprofen, just sort of anti-inflammatory medications. They've tried inserts for the kid. 10-year-old doesn't like using inserts, so he took them out. Kid's a soccer player. The pain really happens after activity, when he runs, when he walks. He gets all that extra pain on the side of his right foot. I did a gait analysis on the patient, checked his range of motion, made sure everything else was just fine with the 10-year-old kid. After presenting to our attending and after her evaluation, we decided that It wasn't really a tendonitis that the kid had, it was more of a structural issue. So we decided to recommend the use of inserts, that he continue using them even though he doesn't like them. We also recommended a more supportive shoe, and a shoe that was actually across the ankle joint to provide that structural stability that the kid is looking for while he plays, including a soccer shoe that actually covered his ankle for that stability that he needs while he's playing.
You know, his ankles weren't more lax. He does have equinus, so he could do physical therapy, would be really helpful. Physical therapy to help strengthen the posterior muscle group, and that'll then help with the anterior tib.
Okay.
The shin splints.
So it's gonna seem tight, but it'll wear off as more that you walk with it.
Like the tape will just start to stretch out as you walk on it.
So here's the... Right. So right, what's the angle that you want to go in? You want to go in this, not that angle, this angle, right?
Yeah. It took us to meet over here.
Right, exactly. More like.
For this patient, she fell about 3 years ago, and she had an inversion ankle sprain. And so from that, over the years, I think she developed arthritis, and she just has a lot of pain, kind of all throughout her foot. And so she has pain in her sinus tarsi. And we noticed that when she stands, so she's a pronator, which means her foot rolls in. And so when you roll in your foot when you're walking, it kind of compresses this area, the sinus tarsi, and so she's getting pain in there. And so what we did today was an injection of lidocaine and Dex, so it's just like a steroid and a local anesthetic, to see if that would relieve the pain. As soon as we injected it, a couple minutes after, she was feeling much better and she was able to kind of walk around. So it's good to see that instant relief for her. And it's more like a diagnostic procedure as well. She can go to like her doctor after and she can say, okay, I just had this done and actually relieve the pain. Now we kind of know like what it is.
And we're gonna get you some orthotics for your knee too. That will help. She just had a callus and she just removing like the inside of it so that when she has like pressure and when she walks, like she won't feel that anymore. Like she won't have any more pain. And then she's just making an orthotic and like adjusting it so that she has like the pressure in the right places.
She's 83 years old, precious grandma. She's here with some pain in her first toe, and we're gonna give her some orthotics to offload the forefoot and also give her some heel lifts to make some heel contact. And yeah, so we'll see. Hopefully, we can find the right supplies for her and make her feel better today. It looks like a lesion.
I don't think that is. I would just have the attending look at it, because that looks a little bit more yellow and hyperkeratosis.
You see her chip complaint of calluses on the medial side of her hallux, bilateral also. She said there was a callus between her forceps.
The pathology that the patients are presenting with varies from pediatric patients that in tow to older patients with diabetes and peripheral neuropathy that have ulcerations that they didn't know about. So students are exposed to a very diverse range of pathology and oftentimes more advanced pathology because the patients haven't sought care or haven't had access to care in other foot and ankle specialty clinics.
Because I've been having pain on my left feet around the ankle, I came in and they offered me free consultation. After he give me the diagnosis and I tell him what hurts and everything, he find out that it was fasciitis.
Where does it hurt?
Right there where it's touching the bottom of the
heel, the bottom
ankle.
of the heelish area. Interesting.
That's right, that's right where the plantar fascia inserts on the calcaneus.
Okay.
So it's usually where they feel the most pain.
Yep.
So we're just going to do like a medial approach and try and get right in there. So we're going to use some cold spray so you don't feel the sting. Okay, stop. Oh!
I got a shot. And I notice it's working. It's a burning sensation.
Nice job.
And I'm glad that I came in, and I'm glad I got some support for the feet, and feels good. Hopefully next year they call me and I can give a recommendation, what it feels like, and if it helped or not, or it didn't help. So hopefully I'll see you guys next year, and I'm glad you guys came in, and you're doing this for the community here in San Isidro. Thank you so much. It's actually feeling better now.
Yeah, the lidocaine will make it feel better like immediately.
Yeah, it does.
One thing that's good about coming down to communities like this is we get to see a lot of pediatric patients and a lot of kids, and it's not something we see a lot in clinic because they're going to pediatricians. And it's awesome to be able to do something for someone that's instantaneous, make them a pad, shave a callus. Things that are so simple, give them an orthotic, and they could be walking around in pain the entire year until they come and see us. And it's just so nice to see the way that the community responds to us being here and how much that they get out of it. It's awesome to be here with students and to be able to help teach. And I'm always learning. Like I said, I got to see a lot of pediatric cases of congenital things that I had never seen and probably wouldn't get to see in my own community.
Over the past 10 years of providing service to this community, we have become sort of like a normal part of the year. Our clients expect us to come. They are so grateful for the care that they receive from the students and from the attendings. They're extremely grateful for the donations that we provide to the community. And we feel like part of the community here. And oftentimes the same people come back and check in with us annually on how their pathology has changed. And it feels really good to serve this population. We have very often, or at least once a day, we'll have somebody leave crying because they feel so lucky and fortunate to have the care that we provide. And the students are learning so much about compassionate care and the relationship that a provider and a patient has in an environment. And at this particular time, with what's happening with immigration and what's going on politically, they're so thankful and grateful for the care. And it really anchors you sort of back to why you went into medicine and the feelings you have when you provide care for people in need and that are just so grateful. In a lot of outpatient clinics, there's too much business to do. There's just these endpoints that need to be met, and sometimes you forget about compassionate care and the relationship that you have and you create with the community that you're in.
In her 70s, farm worker, no access to healthcare whatsoever, but then in such a good spirit, and she was into salsa, and she was always smiling even though she was in pain. It was so good to be able to help her, and more than that, teach her to help herself, help her do things that would really increase the quality of life.
Tracy told me in Spanish that she sees me as a good healthcare professional, and like she appreciated that I spoke in her language, and that was very touching to me. And we were talking about she had confided in me in some things with her family, so it was kind of just now that just happened was like a touching moment for me as like a student, and to help someone like that and to have experienced it first for myself. So it was a good moment for me.
I personally feel very honored to be able to, help individuals here, get to know them more, and also see the impact that we got to make in their lives, and at the same time they got to provide us with the practice that will enhance our skills to provide to future patients.
I do want to say that I feel like I've been here the past 3 years, and I feel like this is one of the best experiences I've had. Maybe because I'm one of the upperclassmen leaders, but also just like the amount of patience we've had, the organization, the effort, and the focus by all the students and staff has been a really great experience.
Serving people in this community has been extremely rewarding. A lot of these people don't have access to healthcare, so when they come in, they're really grateful when you do anything you can. And that's made it super rewarding.
Being out of your comfort zone, I think it's like really something you don't want to do, but you learn the most. And then being able to use my heritage and helping someone else's like life and things I learned at school, because you don't learn how to do these things at school. So I think that's the biggest thing, is applying what you're actually learning to improving someone's life quality. So I think that's the best thing about it, even though it can make you uncomfortable sometimes and you're learning new things, but it's worth it. So, yeah.
Coming from a predominantly Spanish-speaking home, being born in Mexico myself, having a lot of Mexican and Hispanic family here in the States that really have trouble seeking health care that language barrier has a lot to do with it. Health insurance problems have a lot to do with it. So to me personally, this is very close to home. The patients that come in, I feel like I'm seeing my own grandparents, my own parents, cousins and uncles and aunts. So being able to sort of give back to what I consider to be my roots, especially being so close to Mexico and so close to the border, that's just really close to me at home. And it's something that I would ideally like to continue doing. The immediate gratification that I see patients get when you reduce a painful callus, when you trim their painful nails, when you give them a good set of shoes for their diabetic feet, it's a rewarding experience that I don't really believe you can get anywhere else but here.